Dissociative identity disorder, previously known as multiple identity disorder, is a rare condition in which two or more distinct identities or personality states are present in and alternately take control of an individual. Some people describe this as an experience of possession. The person also experiences memory loss that is too extensive to be explained by ordinary forgetfulness. Dissociative identity disorder is characterized by the presence of two distinct or split identities or personality states that continually have power over the person's behavior. With dissociative identity disorder, there's also an inability to recall key personal information that is too far-reaching to be explained as mere forgetfulness. With dissociative identity disorder, there are also highly distinct memory variations, which fluctuate with the person's split personality. The alters or different identities have their own age, gender, or race. Each has his or her own postures, gestures, and distinct way of talking. Sometimes the alters are imaginary people. Sometimes they are animals. As each personality reveals itself and controls the individual's behavior and thoughts, it's called switching. A history of trauma is the key feature of dissociative identity disorder. About 90% of the cases of it involve some history of abuse. The trauma often involves severe emotional, physical, or sexual abuse. It might also be linked to accidents, natural disasters, and war. An important early law such as the loss of a parent or prolonged periods of isolation due to illness may be a factor in developing dissociative identity disorder. A person with dissociative identity disorder has two or more different and distinct personalities. The person's usual or core personality and what are known as alternate personalities or alters. The person may experience amnesia when an alter takes control over the person's behavior. In some cases, the person with dissociative identity disorder may benefit from a particular alter. For example, a shy person may use a more assertive alter to negotiate a contract. More often, dissociative identity disorder creates a chaotic life and problems in personal and work relationships. For example, a woman with dissociative identity disorder may repeatedly meet people who seem to know her but whom she does not recognize or remember ever meeting. Or she may find items around the home that she does not remember buying.
A few moments later.
There are some treatments for dissociative identity disorder. The best treatment approach depends on the individual, the nature of any identifiable and the severity of the symptoms. Most likely treatment will include some combination of the following methods. Psychotherapy, sometimes called talk therapy. Psychotherapy is the main treatment for dissociative disorder. This is a broad term that includes several forms of therapy. Cognitive behavioral therapy. This form of psychotherapy focuses on changing dysfunctional thinking patterns, feelings, and behaviors. EMDR. This technique was designed to treat people with persistent nightmares, flashbacks, and other symptoms of PTSD. DBT. a form of psychotherapy for people with severe personality disturbance, which can include dissociative symptoms that often occur after an experience of abuse or trauma.
Family therapy. This helps teach the family about the disorder as well as helping family members recognize symptoms of a recurrence. Creative therapies, for example, art therapy or music therapy. These therapies allow parents to explore and express their thoughts, feelings, and experiences in a safe and creative environment. Meditation and relaxation techniques. These help people to better tolerate their dissociative symptoms and become more aware of their internal states. Clinical hypnosis, a treatment method that uses intense relaxation, concentration, and focused attention to achieve an altered state of consciousness, allowing people to explore thoughts, feelings, and memories they have hidden from their conscious mind. Medication. There is no medication to treat dissociative disorders themselves, and this condition cannot be cured. However, people with dissociative disorders, especially those with associated depression and/or anxiety, may benefit from treatment with antidepressant or anti-anxiety medications.